So I'll hand you over to Nick.
That's great. Thanks everyone for coming along today, and I hope you'll find the session useful and interesting. As I said, I'm Nick Padden, and I'll be leading on the formation of the Consumer Technology Network. And I also have today Gillian with me, who's the transformation lead in the National TEC Telecare team. So to start, in April this year, I had the good fortune to go and see Joe Lycett live at the Armadillo. If you don't know who he is, he's a comedian who does fantastic, sometimes elaborate things to prove a point against big companies and social injustice. I recommend you look him up. I'll not spoil the show for you, but this was displayed at the end of the show, and I bought a badge too. It really struck a chord with me, and I think it's appropriate for this subject today too. If we want something to exist, we need to make it ourselves. So what do we mean when we say consumer technology? Consumer tech can also be referred to as high street tech. It's high-tech devices, tech devices that are available for the public to purchase and use off the shelf, if you like. The role and use of consumer technology within health and care is gaining momentum across Scotland. It is now being considered as more of a mainstream option to complement or even replace traditional support. A lot of people own at least one device, and to be able to use up-to-date functionality to assist more independent living is so valuable. So who's the network for? It's for the workforce. The workforce is adapting to this shift to mainstream in statutory, third and independent sectors. As a result, we're seeing more tech or digital-based roles emerge, such as tech advisors, digital dementia advisors, thinking differently coordinators, peer support mentors, and care technologists. The list goes on. Shown at the top of the slide there, Alzheimer's Scotland published a report on the findings of their test of change on consumer technology. Recommendations coming out of this include a network for supporting these emerging roles. We'll pop a link in the chat for the website so you can access this report as well. Most will be working on their own within their organisations with no immediate colleagues to bounce ideas off and discuss cases. The new network will provide opportunity in the community of practice to do this. We also want to reach managers and provide a recognised space for guidance to be shared on appropriate skills, qualities and grading for these positions. So why is it important? Because it is. We've had people asking for this for a while now. There is an appetite out there to support a network of peers. It's a Wins for Scotland approach, as testing of devices and using them out in the field is invaluable information to share. Why should we do it all from scratch each time when you can learn from others and build on that information? At the top there, you can see, I'm stealing this from another project, the Learning Collab for the Proactive Telecare Test of Change. They have a saying, share generously and steal shamelessly. In the end, this saves everyone time and promotes best practice. And this is ultimately going to help those we support to lead more independent lives. So why is TEC hosting the network? There were lots of discussions on where this network should sit. It eventually settled on TEC establishing the network initially, as we are able to offer a space that is neutral. We can provide resource to manage and support the growth of the network. We will not be endorsing products or companies, but sharing experiences of using devices. This can allow others to make their own decisions about what would suit their needs and their organisations. And it also allows members to have a safe space to say what they actually think, without retribution from their employer or suppliers that they currently use. In time, we can facilitate the conversations with suppliers to benefit all. We want to encourage innovation, and this we can do as a group. It's open to all sectors: housing, telecare service providers, third and independent sectors. Essentially anyone with an interest in working in the field of using consumer technology to support people in their communities. Longer term, as it develops, The network may become an independent entity, but we can explore this as we go along. So what are we going to do? We have loads of ideas. We submitted our proposal for this network to the Digital Approaches and Social Care Delivery Board, which is now approved. And these are some of the suggestions from the proposal paper on the screen. It's a managed network, so we can work together to achieve greatness. Starting small to establish the community and making it relevant for all those who join and contribute. Then we can start to expand wider and grow organically. So examples of what we could do would be invite speakers to give insights and experience to the group. We can facilitate engagement with citizens and share the findings to maximise the benefits in local areas. Local areas may not have the time or resources to carry out engagement pieces, so this is especially useful for those redesigning their services at the moment. As I also mentioned earlier, we can facilitate interaction with industry and suppliers to have a reciprocal relationship, so we can influence functionality that we want, but not be exploited for commercial gain. Again, it's hard if you're someone who works on their own to keep up to date with tech updates, new versions and additional features, so sharing your knowledge with the group could make someone's day. We're all under pressure and overcapacity these days. So, next steps. The next step is to establish a small steering group. This group is going to look at the scope and remit of the network, set out our guiding principles, and use their knowledge and skills to get the network up and running. We'll be using Microsoft Teams as a platform for this. Most folk have access to this already in their organisations. And there is a collaboration channel in the Microsoft roadmap, so this may be the holy grail of helping any access issues that we currently have. We keep fingers crossed. We want this network to be the place to be and know that you can get trusted information without dredging through the internet for info that might not even be legit. Okay, so what else is going on out there in Scotland? There are already pockets of testing going on using consumer technology and services around Scotland. An example of that is Falkirk have recently completed a Bring Your Own Device test of change funded by TEC. This was looking at testing smart speakers with service users to understand how to connect and receive calls from their alarm receiving centre. It also looked at linking with other devices, including smart sockets, and to control heating and lighting. So this will be our final lunchtime learning bite next week. So please sign up to attend if you haven't already and to hear all about it from Falkirk themselves. So who's with us? Yay! I hope you're as excited as we are to get this started, and we'll be in touch soon to launch the community of practice. In the meantime, you can let us know if you're interested in the chat, or you can email us, and I think Gillian might have put a form link in the chat as well. And we can get in touch with you as soon as we've got it up and running. Well, thank you so much for listening, and over to you if you have any questions or feedback.